Happy October, and thank you for tuning in to a very uplifting episode of Slave Food Conversations, where two African-American physicians, Dr. Columbus Batiste, cardiologist, and Dr. Eric Walsh, emergency room physician and doctorate of public health, explore the role of racism as a unique form of stress and the weaponization of food in the creation of health disparities in African-American communities, irrespective of income. They discovered that eating a whole food plant-based diet in urban communities is not only possible, but is the key to eliminating health disparities. The month of October is not just for pumpkin spice lattes. It's Breast Cancer Awareness Month. The doctors join forces with special guest Donna Green-Goodman, MPH, and Dr. Zsakeba Henderson to discover the role of conventional and nutritional therapy in breast cancer through the personal story of breast cancer survivors and health advocates. Donna Green-Goodman, MPH. They will tackle disparities in maternal and infant health that exist in communities of color with Dr. Henderson, who is a senior vice president and deputy chief medical and health officer for the March of Dimes. Dr. Green-Goodman, MPH, Donna Green-Goodman, MPH, I always make her a doctor, but yes, is a career public health educator. She graduated from Oakwood University, majoring in home economics and nutrition. She earned her master's in public health from Loma Linda University. She has had a rewarding career in providing leadership in developing, implementing, managing, and evaluating public health interventions, programs, services, and staff at a national and state level, as well as within the college and university settings. As a food life instructor and a 25-year breast cancer survivor, Donna discovered the value of the power in plant foods as part of a healthy lifestyle by preventing and reversing disease. Donna and her husband, Eddie, a physical therapist, own Lifestyle Therapeutics, a lifestyle for better health center in Huntsville, Alabama, where she provides wellness, counseling, coaching, and plant-powered cooking classes. Dr. Zsakeba Henderson attended Oakwood University and received her BS in biochemistry. After completing her undergraduate education, Dr. Henderson furthered her studies in the medical field by enrolling in Harvard School of Medicine, where she earned her MD. Dr. Henderson is a board-certified obstetrician and gynecologist. She established and led the Centers for Disease Control and Prevention program in support of state-based perinatal quality collaboratives, including the establishment of the National Network of Perinatal Quality Collaboratives. She currently serves as a director at the Offices of Maternal and Child Health Impact at March of Dimes. Her career focuses on the growth and spread of perinatal quality improvement efforts, working to make this nation a safer place to give birth. The Slave Food team thanks you for your support. Please continue to spread the word about the Slave Food Project and subscribe to our YouTube channel by clicking the subscribe button. You're in for a healthy treat as the doctors give an empowering conversation. Thank you.
Thanks, Danette. Well. This is a treat. Eric, how are you first?
I'm good. We got Oakwood up in the house today. I'm telling you.
Yes, we do. I'm gonna tell you, I feel honored and privileged and just prideful right now as I sit on the stage with these two lovely women. Thank you for joining us.
Glad to be here.
Yes. Dr. Henderson, it's good to see you. Yes, we spent you're on mute right now. I know you think this is back when I used to kind of oversee some of the labs, right? And the pupil surpassed the teacher at the point and they had to be quiet, but you don't have to be quiet anymore because you have achieved greatness.
Well, thank you. It is such a pleasure to be here. And I have to say, I learned so much under your tutelage at Oakwood and following your example. No, really. And I think one of the things that's very valuable about the Oakwood experience is really looking to the classes ahead of you and being able to use them as an example. And I have made it my life's journey, part of my life journey, to find those people that are ahead of me, that are reaching goals that I want to reach, and getting to know them and finding out how they're able to succeed and be successful. So I thank you for being a part of that journey.
Wow. Well, I will definitely have to give you some money. I don't have any right now for those kind words, but it is tremendously appreciated. Thank you. So let's dive in this. And I know I'm gonna start off, but I know Eric is chomping at the bit because this is like his whole entire part of his career and passion and what he does. But I'm gonna jump off because you understand that our platform of what we've crafted here is looking at the intersection between stress, discrimination, and nutritional stress in the formation of health disparities. And so let me ask you, and we start off with a simple question. We ask inside of our core lecture of why do Black people in America live sicker and die sooner than other people? But I want to flip it. Why do Black mothers and infants live sicker and die sooner than other racial groups? And I'm going to address that to you first, Dr. Henderson.
Well, one of the things that I noticed during my time at CDC, so I was in the National Center for Chronic Disease Prevention and Health Promotion. So it seems like an unlikely place for reproductive health to fit, but our work was within the Chronic Disease Center. So we worked very closely with the heart disease folks, those in smoking and health, adult and community health. And I would always watch presentations, and for almost every presentation, they would put up a map and would show sort of the prevalence of the disease or, you know, what's happening with whatever the disease condition is across the country. And it just dawned on me, every presentation, even outside of our center from in the infectious disease side, there was always this part of the map that's always darker or highlighted or red that has the highest incidence or prevalence or risk. And that region, same region, the South, the Southeast, and then it expands a little bit toward the Southwest a bit, but really the South. And I'm like, you know, we talk about, you know, the populations in the area and their, you know, practices and habits. I was like, does anybody realize this is a legacy of slavery? Like,
yes.
It's not a coincidence that every single map, HIV, you look at preterm birth, you look at, you know, maternal mortality, all of the areas that have the worst outcomes are in that region. And that's something that I realized very early on during my time at CDC. And I think it's finally come full circle where people are starting to recognize the impact of the enslavement of Black people in this country on health overall. So some of the same contributors that lead to the increased risk of, you know, for heart disease or for diabetes are the same things that contribute to poor maternal and infant outcomes.
That's powerful. That's powerful. And, you know, what you said, it reflects, we had a guest on probably several months ago. It's been nearly a year, Keith Ferdinand with the American Heart Association and so forth. And he really kind of outlined the very exact thing you were talking about, overlapping the slave trade with the disease burden that exists inside the South there. You know, I read, and I'm not sure if the statistic is correct, but really about the mortality is comparable to what it was in the 1850s. For infants is what I recently read. Now, this was an article citing from back in around the 1850s or so. So it's despairing when we look at the level of hypertension, cardiovascular disease, and this overlay of stress and discrimination.
And the other thing that's important to understand is that, you know, people try to separate mom from baby, or they try to. Mothers and infants tend to be marginalized and aren't usually the focus of support and efforts. When you look at either a state's, you know, funding for public health, or even looking at nationally, and you look at the funding, maternal and infant health doesn't receive like the bulk of the money. But really, maternal and infant health is the canary in the coal mine of our nation's health, because moms and babies are some of the most vulnerable populations in our country. And when you look and compare across countries, unfortunately, for a country that spends the most per capita on healthcare, we have the absolute worst outcomes for moms and babies for industrialized countries, and that is just not acceptable. And it's so unfortunate. And I think part of that is the realization that in order to really address these outcomes, we're going to have to really address the inequities and the disparities that are happening among populations that are at highest risk for poor outcomes.
Wow. Yeah, I know, Eric, you dealt a lot with all of this with your time as far as a city public health official, and you dealt with it. So share some of your experiences that you had.
Yeah, especially when I was with the health department in Orange County, California, we dealt with this a lot. And one of the things that I really enjoyed was I did a lot of work around promoting breastfeeding, and I used to joke when I do lectures and say, you know, when I won my state championship in high school football, I never thought I'd grow up to promote breastfeeding, but breastfeeding is just that important. I mean, you can't health without promoting breastfeeding. It just doesn't go together. And this, you guys really should have been the first guest we ever had on this show, honestly.
Yeah.
Because when you think about what sets Black people up to be sick for their entire lives, it happens in utero. It is the intersection between the health of that mother and the health of that developing fetus that actually projects things. And how? Well, for my dissertation, I was doing my doctorate in public health. We did work around how stress impacts the weight of the baby early in life, when that weight predicts later life obesity. And what we found is that the cortisol releasing hormone levels, and so, hence the amount of cortisol that would cross the placenta and affect the baby, was actually quite relevant. It has a lot to do with what happens later on. So intrauterine, the stress of the baby produces intrauterine stress. And the basic way to look at it is that what happens is that the mother's body begins to tell the baby, you're going to be born into a stressful environment, get ready for it. But when that happens, the baby develops different. This is where epigenetics starts to play a role, and all of these different things. One of the ways that the baby's body begins to prepare for a more stressful world, because its mother's been stressed, is that it actually lays down more adipocytes. It actually lays down more fat cells, predisposing you to obesity, because all those fat cells that would not have been there are going to crave to be filled for the rest of your life. So it puts you at a disadvantage. So when people are just like, oh, just lose weight, oh, just get slim, especially when they say that to Black people, it's a difficult thing when our mothers are so much more stressed when pregnant than anyone else. This also impacts the timing of labor, right? You can actually shorten gestation because the mother's body says, well, we're under stress, we need to get the baby out sooner, right? So that it then causes its own set of problems, like the actual development of the child's brain in utero. You don't get the full time to develop. All of this stuff, I think, lays out a whole lot of bad things. But most importantly for the Slave Food Project, it increases the risk of lifelong chronic diseases that we talk about all the time, makes you more sensitive to stress for the rest of your life, right? You become more cortisol resistant much more easily, which messes with the immune system and does all of those different things. And the other last thing I want to just comment on what you said is, there are pockets of Black America where the maternal child infant health parameters are worse than countries like Cuba and other poorer countries in the world.
It's true.
That's how bad it is for Black America. And if once you get that, everything else about our health disparity paradigm for the rest of our lives starts to make a lot of sense.
I know. As I listened to Dr. Henderson remark about the history of slavery and its legacy towards us, my first work was in the state of Georgia for the Georgia Extension Service, and we were responsible for, I was working in a nutrition health education program, and it was in 159 counties in the state. And so eventually I got to the place where I started traveling the state, and I had to live in the communities that I worked in before I got to the state office. And the legacy of slavery that we're carrying, coupled with the daily stress that Black people experience in the South. I mean, we know racism is everywhere, but I was amazed as I moved into rural Georgia, and there were Black people who would still move when a white person came towards them, and who lived in homes that were up on stilts, and you could see the floor, the ground beneath their homes. And the interactions that they were having medically, they just were subpar. And so when I left those rural communities to move to Athens, Georgia, I'm thinking things are going to get better there. And I myself was having some female problems, went to a white male physician. He never examined me. He talked to me about what was going on. And the first thing out of his mouth was, well, you probably have what this other group of women had, so we'll probably just have to do a hysterectomy on you. And I'm thinking, what about all the Black women across this state that I was living in who could not advocate for themselves when they were in this situation and were living under the constant stress that you're talking about, Eric? And it just broke my heart. And so my work was in these homes with these women, and to see them make it the best way they could against all the odds, it was just amazing to me.
You know, that's interesting because one of the things that I read is that, I mean, you're obviously highly educated. And so your education and your understanding allows you to really kind of question and seek different care. But one thing, and Dr. Henderson, you can kind of illuminate this a bit more, is that I read that the maternal statistics of mortality, it doesn't improve based on your education. That it doesn't get better just because you're more educated or lessen. It actually seems to increase. So speak to that a little bit.
Yeah, one of the things, and it always comes up when we have discussions talking about strategies to prevent and reduce maternal mortality in our country. And the sad thing is, you know, the first thing we think about is the socioeconomic piece, which is important. We need to make sure people have the resources and that, you know, they have places to live, healthy food to eat, have jobs, and have, you know, but it's not a socioeconomic issue with maternal morbidity and mortality, and the same for preterm birth. When you look at the disparities between Black women and white women, they span across socioeconomics. So women who, just to give an example, for maternal mortality, a Black woman with a PhD, with a doctorate, has a higher chance of dying from pregnancy than a white woman with less than a high school education.
Wow.
That's unacceptable.
Absolutely. Wow.
Unacceptable. And then you hear some of these stories in the media about people who had poor experiences during birthing experiences. So this gives us some evidence that it's not just a genetic or physiologic reason why Black women are dying. We're looking more into issues around the care that women receive. There is evidence that shows that there is bias in the care that's received, that complaints aren't listened to, aren't taken seriously in some cases. Certain symptoms may be overlooked and not treated as aggressively. There have been studies looking at the quality of care within an individual hospital and comparing across hospitals. And even hospitals, when you look at hospitals that have lower resources and care for majority Black women versus hospitals that have higher resources, the outcomes are worse in those poor resource hospitals. But even when you look at an individual hospital, a high resource hospital, there's still disparities between the outcomes between Black and white women. And that is unacceptable.
There was a really good study that showed that when they took African women who had migrated to the United States, their birth outcomes were the same as white women. That first generation that came to the United States,
next generation,
but their daughters exactly was the same as Black American women. Which, you know, in the slave food, when we do our lecture, that what we say about that is that there's literally something toxic about America for Black people. And if you wanted the proof in the pudding, that study is the proof in the pudding. There's just something about this country, and we know what it is, but there's something about this country that causes that disparity.
And one is important too, you know, we talk about lifestyle and the contribution to health outcomes, and it's important, you know, for pregnancy too. It's actually especially important because you're not only, you know, worried about the health of the mom, but of the unborn child. But one of the things that we're trying to be very careful of is that even in situations when all other things are equal and people have poor lifestyle choices, Black women still have worse outcomes. And although, you know, we're very quick to want to blame a patient, like, you had this poor outcome because you weren't eating right, you didn't go to your doctor's appointments, you're not a compliant patient. But really, when we compare across races, patients with similar conditions, similar situations, similar health status, the outcomes are still worse for us. So there's definitely something other than things that we can blame or put the blame on patients for. And I think the onus is on us to take responsibility for the systems that we have in place and recognize that, you know, our systems are unequal. There are issues of how we care for patients. There are issues about how not just the interpersonal provider and a patient, but also the systems, how things are set up. Simple things like, you know, when a patient shows up late for an appointment and they can't be seen. Something as simple as that type of policy, you know, discriminates against patients who may have difficulty in transportation or childcare, or may have problems getting to an appointment. Or policies around, you know, providing resources upon discharge, or, you know, even like I look at Grady, and there are still some legacies, you know, from you know, Jim Crow period, even how the hospital is set up. It's set up like an H, and Back in the day, it used to be the white side of the H and the black side of the H. Now it's the Emory side and the Morehouse side. So there's still, some
Racism.
Exactly,
Racism.
and it's different.
Wow. Let me downshift and pivot just slightly over, because this same topic, this same information applies to breast cancer, right? And so we know that a lot of these same issues of stress discrimination, disparities exist with breast cancer. Before we dive into that, Donna, you're a survivor. You're wearing pink today.
Yeah.
Tell us your story. Share your story with us.
25 years ago, after that doctor in Athens mistreated me, I found another physician who happened to be a white male, but he was in my age group and seemed to be more progressive minded, and we really trusted him. And he cared for me during my pregnancy. It was just wonderful. And then probably when my son was about 7 years old, I went for an annual, and we had been following a lump in my right breast that behaved as a fibroid adenoma that I'd had before. So we weren't worried at all. But he decided, let's do a mammogram. And he asked me when was the last time I'd been on vacation, and we couldn't tell him. So he told us, go to Cancun, tell me when you've made the reservations. Came back from Cancun. He said, we need to do some more testing. We did, got on a plane, went out to Seattle, came back, and he says, okay, now you need to see a physician. I went to a white male in Athens that he referred me to. And the doctor says, you can either have surgery or we can watch this for a while. And I decided, because I was living in Atlanta at the time, I'm going to go ahead and get another opinion. Found a Black female physician who scheduled me right away for surgery, did the lumpectomy. And as soon as she opened me up, she knew it was cancer. I didn't know it for the next 2 weeks. She asked my husband not to tell me so that I wouldn't worry about it. And 2 weeks later, as he was preparing for the Peachtree Road race, we got the call that indeed it was breast cancer. And I needed to come back to have the axillary dissection. Went back, took out 17 lymph nodes. 6 of 17 were positive for breast cancer, invasive, and now metastatic. And so they're recommending all of these things for me: chemo, stem cell, chemo, radiation, tamoxifen, and every doctor, oncologist, male, female, Black, white, whatever, because I was in the Emory system there in Atlanta, is saying that it's really, really bad. And so what was so ironic to me was that I had just left the job at Morehouse School of Medicine teaching how to reduce your risk for all types of cancer, and was now working for the Office of Nutrition for the state, developing wellness programs for the entire state. And I'm thinking, okay, I know that there's got to be something else that I can do that is not going to be as toxic. Looked for some resources and decided that I was going to pull back, pray about it. Contacted people at Wildwood Lifestyle Center and Hospital to go there to build my immune system and then come back and do the treatment. And while I was there, I was confirmed in what I had studied at Oakwood and Loma Linda, and what I was practicing every day. And I decided that I wasn't going to do all the treatment that they wanted me to do. I was going to choose what I was more comfortable with, because back in '96, even if I did everything that they wanted me to do, most of the women died, like 70 to 80% of the women died anyway. So I opted to pull away from that and to do, people call it alternative medicine, but if you really look at it, it's the steps of primary care, or lifestyle medicine as we know it now. And as Dr. Henderson was talking, you think about risk factors associated with certain outcomes. And so what I decided to do was to address the risk factors in my healing process. And so I came back. I was already vegetarian, but I wasn't fully plant-based. I went on a fully plant-based diet, changed my exercise routine, my work routine, used some hydrotherapy. I really had to address the stresses that I was facing. Dr. Henderson understands how the drive is downtown Atlanta on I-20 in the morning. And that was just too much for me. And I really started to focus in on living, because they gave me 2 to 5 years to live. And when I went for my 6 months checkup, she said that everything was worse, and she wished that I would come back and do what she asked me to do. And that's when I started praying again. And then we were headed for homecoming, and people were wondering what was going on. And I went to the doctor's office and I asked to see my records. And this time when I looked at my records, actually, I discovered that what she had told me in December was not true. all of my cancer numbers were going down. And as I sat there that March, the numbers had gotten lower. And I asked her, what was this? And she said that I wasn't cured because I didn't do what they said, but the numbers said that I was cured. And she told me that she didn't want me to go around and tell people that if they changed how they lived, they could get better.
Wow.
This is a Black female breast.
Mercy. Wow.
So, then I'm like about to jump out the chair because I realized that there was more to this going on than just the breast cancer diagnosis. And I've continued to do it and incorporate it into my profession and share it with other women, and the specific things that increase your risk for it: overweight, hormone imbalance, stress. And every woman that I've met in the last 25 years who's been diagnosed has had some level of stress. The first woman I met in an abusive relationship, and she didn't know she had breast cancer. She was having bone pain, and that's how she found out, and she didn't live very long. So the impact of stress, all those things that now science 25 years later is affirming, is what I've been sharing with people as I've interacted with them.
Amen.
That's an amazing testimony.
Yeah.
God,
That's powerful.
And I think for me to be able to, I mean, we talk about diabetes and reversing that and opening up plaque and heart vessels, and even providing the type of support that a pregnant woman would need for a healthy outcome. But when it comes to cancer, we're a little more cautious about what we can do with it. And for me to see as a public health professional that this wasn't willy-nilly, the numbers were dropping. They were literally dropping in front of me. In addition to that, I made all these decisions to rid myself of breast cancer, but my weight improved, my constipation, my migraine headaches, all the imbalances that I was having, female problems with, my son's allergies went away. And I know in the past, Columbus and Eric have talked about men who have problems with an erection. And literally, my husband and I were not having those problems, but everything got way better.
Watch yourself now, Donna. Watch yourself. I think he may be listening now. Watch yourself.
And he agrees. I'm like, wait a minute, where is this coming from? And so the benefit of it didn't just help me, but it helped my family. And then, of course, the people that were asking me, what are you doing now? And of course, my physician, 5 years out, she's ran into my husband at Peachtree. I wish she'd come back and do what we asked her to do. And we didn't pay attention to that.
I'm gonna jump in real quick and say this, that one, I mean, that's what a blessing, and what a testimony in terms of what you went through. And I think it's phenomenal. I think one of the things I want to highlight really in your journey is not just the fact that you were blessed with success going down this road in terms of choosing lifestyle, but really the fact that you chose accountability. So you still went back to still have tests to see how things were. Now, maybe the information wasn't communicated correctly to really guide you effectively, but I think that that's powerful. That's important, right? It's important to go ahead and make sure whatever we do. So if I prescribe you a particular pill for your cholesterol, or I prescribe you a pill for your blood pressure, I'm bringing you back to assess the therapeutic impact, right? And I gauge the aggressiveness of the treatments based upon the severity of the situation at that given period of time. So I think it's important for everyone out there looking at this component of check and accountability and following up is extremely important. And we'll touch on shortly, but really about screenings and everything else like that too as well. Eric, sorry, I cut you off.
Oh, no, I was just going to jump in and say, first of all, just praise the Lord. That's a powerful, powerful testimony. My mother, when she had cancer, went to Wildwood as well. And I can tell you that her numbers always got better when she spent time at Wildwood. She didn't stick to what they taught her.
Right.
As long as she did what they said, her numbers got better. So it is a statement of the power of lifestyle. We know that when we look at, we have slides that we show in some of our presentations when that stress, especially racism, actually increases the risk of breast cancer in Black women and other cancers as well. But this is why one of the 8 laws of health is trust in God, right? What buffers stress better than that spiritual connection? And so, that's one of the reasons why it's part of what what we're supposed to do. I also wanted to comment on the fact that one of the other frightful things that connects breast cancer to maternal child health, if you sit in the middle, we talked about stress, but it's also the fact that the government and our society does not make it easy to make those healthy choices either. I mean, the big corporations basically are trying to get people hooked on certain foods that we know, will increase risks of some of these diseases and cancers. And what I really found sad when I worked in public health and ran a WIC, had a WIC program under my supervisory powers twice, once in Orange County and once in Pasadena. What I found interesting was the very WIC program itself, and many of those programs actually tax-funded dollars bought women and infants and pregnant women, gave them foods that were completely not healthy. It was mind-blowing when I found out some of stuff. And the amount of formula they used to give away. I think they're much better now. Yeah. So when you look at all of that, not breastfeeding, to go back to breastfeeding, one of the things that can help protect against breast cancer is breastfeeding. But the government basically stymied women from doing it by giving out, bucket loads of formula all over the place. So your testimony is powerful for the proof in the pudding that if we can go back to what God has ordained for us to do, a whole food plant-based diet, even diseases like you said beyond diabetes and hypertension, even they can be reversed.
I think too, Eric, that the thing that I enjoy so much about you in Columbus is the relativeness to culture. And when you talk about your mom at Wildwood, because of my training at Loma Linda, I'm sitting there part of the day as a patient, and then the other part of the day as a health professional, thinking, okay, well, I don't know. And what concerned me so much, and we see this everywhere, is that it was not culturally relevant. And so it would be hard for your mom to go home and do it. Because,
very true.
I just learned some collard greens and cornbread one day, and they didn't know what I was talking about. So I know anyone who was of a Caribbean history, they wouldn't know how to do rice and peas or anything, callaloo like that. And so making it so that it is culturally relevant is very, very vital for people. And I remember I got to do some stuff with Morehouse after this when I was still working for the Office of Nutrition. And we did a health fair thing over there. And I did a homemade banana pudding. And the then president of Morehouse is walking up and down the halls. Hello, how you doing? And he came and got a little taste. And he kept walking. And about 5 minutes later, he comes back. What was that? I need some more of that. And so, and this is what Jesus did. This is what Jesus did. He made it so that it was relevant to where people were. It was better than anything that they had. He attended to the needs that they had. And I think when you do that, it endears them to you to want to continue, to do what you're suggesting that they do.
Amen. That's very, very astute. Powerful.
It is very powerful.
Yeah.
And so, I mean, looking at your story, and obviously you had that 25 years ago. You're a young woman now, so you were a baby back then when you had that, right? And I mean, so this immediately dovetails into the next kind of thought process is that why is it that Black women have it at a younger age and obviously have higher mortality from this? What are the thoughts with that, Dr. Henderson?
Actually, there is evidence that shows that Black women tend to not be diagnosed as early as white women. And the ironic thing about breast cancer is that the incidence is actually higher among white women. So there are more white women that get breast cancer, but yet more Black women die from breast cancer. And a lot of it, I believe, has to do with late detection. And not only late detection, but they tend to have more aggressive cancers that are more resistant to the current therapies that are available. And I don't know the reason why Black women have more aggressive cancers than white women, but those combined factors contribute to increased mortality.
I do know that as I began to make lifestyle changes because of my training, I didn't want to just, we can sometimes poo-poo things that are outside of modern medicine. And so I knew that if I was going to share this information, I had to come with the data. And so the lifestyle changes that I started making, I was making because my parents had raised me making them, and they accepted them by faith when they learned of all this information. But as I started looking at it, there's some data that says that if you're not exercising, you have an increased risk of aggressive breast cancer. If you're not getting the sleep that you need, you have an increased risk of breast cancer. If you're not of aggressive breast cancer, if you're not eating a diet that is high in fiber and phytochemicals, there's an increased risk. And so again, we go back to risk factors. And I'm in a couple of breast cancer survivor groups online, and they're all talking about, today I read one post where, how in the world are we supposed to do this when we have to take care of our families, work our jobs, they went on and on and on. And so the stress of that we're living through, and that's where I was when I was diagnosed. My husband and I were struggling. My brother was diagnosed with AIDS. My dad was just diagnosed with colon cancer. I had a student who was killed in a car accident who was supposed to be coming to my house after Freaknik, and just boom, 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 boom. And it's never a chance to refuel. And so to me, the science behind lifestyle is an amazing way. And the interview that you had a couple of weeks ago with those two ministers, reaching our people from the faith perspective and what the Creator God wants to do for them is such an easy way, and then showing them the science behind it, and then watching them walk it out. And when you said to me how I went back to the doctor, that's what happened in the Bible. Jesus would heal somebody and he'd say, now go show yourself
to the priest.
So that they can confirm that you don't have this anymore. And when you have the data, it's kind of hard to refute the data.
Yeah, it's lifestyle is so powerful, especially the combination of diet, exercise, sleep, stress reduction through trusting, and like we talk about New Start, but it's so very powerful, especially with people who've had cancer.
And I wanted to chime in and mention vitamin D.
Yes.
We are learning so much about vitamin D deficiency in our people. And a lot of people don't know vitamin D is actually a hormone, and one of the things it does is it helps regulate and make effective the immune system.
Right.
So it's not hyper-inflammatory. And so when you start to look at that, my mother worked in the basement of a hospital in Connecticut around the radiation of those ancient computers from the 1970s. There's a lot of reasons on top of all the things that was just mentioned by Donna, of all the reasons she might have been stressed. And the other thing that actually does this, we talk about cortisol resistance. When you're stressed for long periods of time and you don't get to regroup, after a while, your body becomes resistant to cortisol, which means your immune system its inflammatory response becomes unchecked. The immune system can't do its job of holding cancer, or I should say mutated cells. And then you throw in that if you're a single mother like my mother was, or like some of my aunts were, you're drinking caffeine to be able to go to work and school, and now your sleep quality suffers even more. And it's when you sleep that the immune system actually does most of its cleanup work around these mutated cells. So you start to step back and see the lifestyle piece. I think one of the things that's interesting from your testimony, Donna, is when the doctor told you to go to Cancun.
Yeah.
Somebody picked up that you needed to get away. And here's the thing. How many of our people get vacations like that?
They don't.
Right? My mother, she didn't when we were growing up. I mean, she didn't get vacations like we did. Travel out of the country for the fun of it, that wasn't even an idea. And so I will soften that by saying she did have the Sabbath. That's the only way I can soften that, is that we did have that one weekly time vacation. But otherwise than that, we didn't get much else. And this is why all of these things are so important to our health.
Yeah.
Absolutely. When we look at the platform of Slave Food and we talk about a lot of the biases and so forth that can exist, and implicit bias, which is obviously subconscious. I joked on a recent panel with the fact that I too carry implicit bias, and that I'll think people from England are somehow inherently smarter when I hear their voice. It's like all of a sudden I have a bias that they're somehow more intelligent. And so that's a positive aspect, but the negative aspect is something that we all know is pervasive. And that can actually, unfortunately, impact even screenings. And we know right now, coming out of 2020 and the pandemic, screenings for cancers are down. They're at an all-time low and so forth. And so the trajectory and the expectation is we may see a surge in those in the future. And so, Dr. Henderson, speak to screenings and self-exams and ways in which you spoke really about how the younger African Americans may be later to being diagnosed. And so how can we encourage folks to become owners and advocates for themselves and their health?
Absolutely. So aside from, we promote, making sure you do self-exams, but having that clinical exam by a clinician is so important. But aside from that, making sure you get your mammograms and get them early. And we recommend over age 40, 40 and over. But if you have a family history or have any other risk factors, you need to be getting mammograms earlier. And then once you get your mammograms, continuing to get them on a regular basis. And I know one thing that I had to, even for myself, I have to practice what I preach. I realized I was telling patients, get your mammogram, and I looked up and like 4 years had passed and I hadn't had a mammogram. And I'm like, how can I tell this patient? It dawned on me, you need to get a mammogram, and I haven't had one in 4 years. Needing to make sure you take the time to get your routine surveillance. And not just, we talk about, mammograms for the women, but it's also important, for men to make sure you're getting your prostate checked, making sure you're getting the routine surveillance for colon cancer. I know colon cancer is another big killer of our folk. And I know my family has been personally touched by just the deaths from colon cancer, another thing that is preventable if detected early.
The challenge with the testing, I was 37 when I was diagnosed, and the only reason that I got a mammogram was because we wanted to rule out that anything was going on with this reappearance of this lump. And so the other thing that I'm noticing, the age requirement hasn't changed in 25 years. You still need to be right at 40. And I keep running into Black women who are 25 and 31 and 36 and 39. And so there's no way that you're going to be able to catch that, because sometimes it doesn't present as a lump. Sometimes you don't feel it until there's a woman that I just met, stage 4 when she was diagnosed. It was everywhere except for her bones. And she was 39. So she wouldn't have even qualified to get the mammogram. And then that makes me wonder, Dr. Henderson, you might be able to answer this, or Eric, is that part of this institutionalized racism that we're not allowed to access that type of care sooner, knowing now that so many more African American women are diagnosed earlier with later stages? It would seem to me that you should be able to get something done earlier, but these women it's not happening for them.
Yeah, and that's why I recommend, even though for the general population there is one recommendation, acknowledging and recognizing that we're at higher risk for poor outcomes. I mean, get it earlier. Ask and be assertive and advocate for your health when talking to your healthcare provider.
For sure.
And I would only follow up and say, one of the things you got to remember is who determines when we get these screening tests. Well, part of it is the insurance companies, because they're the ones who determine when they'll start paying for it. And unless there's a medical reason for it, quote unquote, they're the ones who've set some of these age limits. And if you were the insurance company, would you really want to start screening for some of these tests 10 years earlier? You probably don't, because all you see is the upside of cost, right? I mean, so as unfortunate as that is, there is a true profit motive in medicine that can be dangerous. And this is one of those areas where it kind of surfaces, because really there should be an algorithm. A cutoff of an age with the complexity that we now understand is human biology is a really unfortunate thing, because you can't blanket it. There should be other nuances that allow some of these tests to be done sooner.
The other thing that was interesting is family history. And when I was diagnosed, I went looking all in my family tree and I couldn't find anything, but we go back to slavery and the history of slavery, and you really don't know who all your relatives are. And my dad and his brother were conceived outside of their father's marriage. And it's just within this last year that I got to speak to my dad's sister, who found out that on that side of the family, the women had breast cancer. But we didn't know that 25 years ago because of the way our family came about. And so if you're talking to the average Black woman in the neighborhood, she doesn't always have access to all this sort of stuff either. And to me, this is when preventive medicine and lifestyle medicine can always be introduced and be supportive as they discover whatever they're going to discover on their journey to better health.
Yeah, I just want to chime in. I think that what becomes extremely important is that we ensure that everyone becomes a strong patient advocate, like Dr. Henderson says, for yourselves. And so here's the thing is that irrespective, our tests are for a broad span, and there are ranges that are based upon some esoteric numbers that may or may not include you at times. It just depends upon what the parameters are and the reference points are. And so what always trumps are your clinical impressions. So it starts, like was mentioned already, with a breast exam if it will detect it, but also family history and this full knowledge. And at the basis of all this is really communication with your provider. And if you don't have an excellent communication with your provider, it's like dating. It's like dating. It doesn't mean that they're bad, but you gotta find someone else. You gotta find someone else to hook up with, right? That's the goal until you get that relationship and that interaction that you're able to communicate well.
Absolutely. So a couple questions with regard to the conversation that has been amazing. So I know that we had kind of mentioned a couple of things in terms of childbirth experiences and, what happens and what occurs in Black African-American women, regardless of their economic status. I know when I was delivering my own child my first child, I was told at that point in time, when I couldn't push through, and I was told push through the pain, right? Like they're like, push through the pain. We're turning your epidural off, push through the pain. And, you do have to wonder in terms of in some of those moments, your ability to advocate for yourself is not necessarily, you're not in the right frame of mind in those situations. So what do you all recommend in those situations when Black women are delivering? What kind of support system do you feel that they need to have in those delivery rooms and beyond?
You just said it. They should definitely have a support person with them to help advocate for them. I mean, we know women are so vulnerable during the birthing experience, and you often don't want to speak up, or you feel like you don't feel empowered to speak up. Right. But having someone else in the room to help speak for you, whether that's a family member or a doula, someone who's trained to support women through this experience, is good to have someone to not only advocate, but to also be a witness. And to be available to recognize, when things are happening, if something's not right, and being able to help advocate for you.
Absolutely. So the question is, and I know that was mentioned that I think, Donna, as part of your story, something was identified and the doctors told you they wanted to wait and watch it for a little while. Yeah. Why is that a recommendation? And I know I've talked to other people and they said, oh, we've seen something, we need to watch it. Is it better to have it watched, or is it better to go ahead and be more aggressive and assertive with a treatment plan?
I think that there are a number of things that feed into that. Who is the doctor that's saying that to you? And in my case, it was a white male. I'm like, I'm out of here. I'm going back to Atlanta to find somebody that looks like me to see what they're going to say about it. The other thing is, they want to see if there's going to be any change in it. And he didn't say that we needed to wait a year. He's like for a couple months to see if there's any significant difference. But because of my experience in the system where I was living, I decided that I wasn't going to wait. I was going to get a second opinion. And if perhaps that doctor had supported what the first doctor said, there may have been a different outcome. But she is like, no, we've got to get in here right away and see what's going on. And so, like Columbus said, if it's not working with your physician and you're not real comfortable, find another one.
Find somebody else.
Take somebody there with you to document what you're going through, and don't allow them to mistreat you because your life is at stake.
Right. Right. So are there reasons to wait and versus, to have something watched, or is that time when you're waiting and watching putting you in a more vulnerable situation with whatever could be wrong?
I don't know, because I don't know. You don't really know what it is till you get in there.
Right.
So I really don't know. But if there's something that's unusual, get to somebody where you can get some things. And now 25 years later, I'm sure the tests and everything that they're doing, I've heard of people who are getting needle biopsies instead of having to go under the anesthesia like I did, and they can still get some stuff. They don't have to do all of the lymph nodes like they did with me. So it really does depend. And then the second thing, I know that sometimes physicians are concerned when their patients come in and they say that they've seen something on Google, but Google can be your friend if you are looking at resources that are reputable and evidence-based that can explain some of those things to you. And then if you're an African-American woman, do not wait.
Right.
Do not wait. Find somebody as soon as you leave that office. If they've told you to wait, go find somebody else.
And so I'm gonna jump in real quick. And so I agree with you. And I think it goes back to, I keep emphasizing the same point, which is communication. I think that is indeed the bridge in every single aspect of life. And I think that what your provider is telling you should make sense. And I think that I think for people out there, there's a shock factor that happens when you're given a diagnosis of the C word or any type of word. So cancer, heart disease, heart failure, whatever it may be. And so that shock value, it's hard to absorb. And so you need to go ahead and gather yourself and write all the questions down, and then be able to provide that back to bring it back to your provider and have them communicate it to you. And if it does not make sense rationally, not expecting you to become like a scientist or a specialist, but it should make sense in practical terms, then that's at the moment that maybe it's time to seek and gather so someone can convey understanding to you.
If the glove doesn't fit, is that kind of what you're
I would only chime in and say this is also why it's important to have a good primary care physician as well.
Yes.
Someone who you trust, that you have a long-term relationship with. If you don't like them, find one that you can, so that when something comes up, you actually already have a healthcare provider advocate in your corner. Right. For a lot of us, we don't use one for years and years and years. Something happens, and now you don't have that person who knows you, that you trust, to go to. And so that is one of the reasons why I think that's an important thing to have as well, so that you can get that real world advice from someone who knows you.
And Dr. Henderson?
No, so what I would say, if you have a clinician or someone who's caring for you and you don't feel comfortable, or you feel like they're not listening to you, sometimes people are afraid or feel like they can't change their doctor. Or even with maternity care, if you're seeing a doctor and you don't like that model of care and you prefer to see a midwife, never be ashamed to find the care provider that you feel most comfortable with. And it's okay to change. It's okay to get second opinions, and it's okay to speak up and advocate for yourself. Ask questions. And just like you said, Donna, when you mentioned looking up things on Google, it's like docs cringe and talk about patients so bad. They come in with where they say MD from Google.com. But really, it's important to be empowered with information. And there are, as you mentioned, reputable sites where patients can get information and be informed, to be a basis to ask questions. And I always tell patients, ask questions. If you don't understand, ask. Right. Continue to ask until you understand. Make sure you get the information that you need to make sure that you are a partner in making decisions for your health, and making sure that you have autonomy with your care, because there may be decisions that your doctor or care provider makes and you don't agree with it. You have a right to decline. You have a right to ask for more information. It's your body, and you should be a partner in making decisions in your healthcare.
We have a question in the comment section, and it is, what is the most effective method of disseminating proper health information to the at-risk population?
Wow, there are lots of ways. And I think if we had the answer, I know at March of Dimes, we work really hard at studying that and finding out the best way to disseminate information. It's really meeting people where they are, and there's not necessarily one place.
Right.
Some people, you can reach them through the internet, and you can, do all types of information online. Others may not have internet access. So you have to do print information and make it available in doctor's offices or community groups and centers. There's often, using unconventional means, like groups that may not necessarily conventionally partner with healthcare. I know one way that we reach people through various service organizations across the country, including like fraternities, sororities, churches. There are lots of different ways to get information, and I say use them all.
For the people that are at the greatest risk in the communities that I worked in Atlanta, we were partnering with local churches, and what we discovered, or I discovered as we were doing it, was that is the one place where all of us go, whether we are the maid or the owner of whatever. We all seem to end up in our fraternities, our sororities, somewhere we're coming through church. And at the time, I partnered with the health ministries team at New Birth Missionary Baptist Church. And I think back then their membership was like 25,000. And the reach that they had was unbelievable. Even to this day, I get calls from women that I did not meet, but who connected with me back then. And the other thing that's still strong in our community is radio and podcasts. And it's not nearly as expensive as some of the other things that you do. And we were able to get on the leading gospel station back then. And the people would call in and we'd go meet them at Kroger's and teach them and walk them through. And so, like she said, where are they? Go where they are and give the information to them there.
Exactly. All right, I'll turn it back over to you guys. Thank you.
All right, thanks, Danette. Man, this has been incredible. There's so much that plagues the United States as a whole and the African American community specifically, and it's important. I mean, I have a mother, have a wife, daughter, and so the information you ladies laid out today it's empowering. And so I'm gonna ask for everyone to go around robin and leave folks with hope, leave them with what the tips that you recommend for them to make a change kind of going forward, or awareness. So we'll start first with you, Dr. Henderson, and then go to you, Donna, and then Eric.
Yeah, I just want to say a lot of people are surprised to hear about the statistics around maternal deaths and long-term complications from pregnancy and how many families are impacted. And one thing I can say is that about 60% of those pregnancies are preventable. So there's hope. There are opportunities to prevent those deaths. These are people that when they're lost, it is a huge loss. I mean, we not to put a value on the different types, of lives, versus men, women in different ages, but a young woman carrying a child who dies is just tragic. And I just want to encourage those to find out more about, ways that you can find out about women's health, how to make sure that you have the best pre-pregnancy health possible if you're planning to have a child. But most of all, making sure you're armed with support and information and providers that you can trust, so that when you have issues that you feel like you are heard and that you're working together with your healthcare provider to prevent any of these poor, tragic outcomes. One more thing, I have to throw this in because COVID has been a huge impact on pregnancy and childbirth. Just in the past couple months, we've seen an increase in deaths to pregnant women to COVID. I'm just going to put a thing in. I know some may not believe in vaccination, but when looking at the alternatives, I would like to encourage, if you're planning to get pregnant or are pregnant, to be vaccinated.
Good. Thank you so much. Donna.
Breast cancer does not have to be the end of your life. As a Black woman, because we are at higher risk of death and developing more aggressive forms of cancer, it's important for you to identify a healthcare team that you can trust, do the breast self-examinations, and get help if anything is identified. But remember that your breast is attached to a whole body that is impacted by everything that you do. And I did a quote years ago when I wrote my first book. Lifestyle is probably the most underprescribed medical treatment for chronic disease. Yet when prescribed and faithfully applied, it is the most powerful medical treatment available and has no negative side effects. So whatever your medical care team suggests for you to do, chemo, tamoxifen, whatever you decide on, also make better lifestyle choices, because that will help you through the process of breast cancer and all the other comorbidities that we experience as a people, and lead you to a better outcome.
Very good.
I simply just want to say, I think what our two guests tonight really tell us is that each of the women that are listening are worth it. They're valuable. And I mean, you can see, I'm so proud of both of them and all they've accomplished. The testimony that I heard tonight actually warmed my heart. I was almost in tears over here, because I just like to know that God moves. I like to see and have people hear that he's real. And these are tough times to be alive. I mean, COVID was mentioned, but I think we have to remember, each one of us, that we are valuable, we are worthwhile. And that's why lifestyle interventions make sense, because it's an investment in our own health and longevity. and the clarity of our own minds. And despite the fact that the stresses of our society and the devaluing effect that racism tries to have on us, none of that matters, because we must value ourselves as God values us. And with that, some of these decisions to live a healthier life actually become easier.
Incredible. This has been phenomenal. And so once again, I thank each and every one of you. This has been empowering, and I know that someone out there who's listening is going to be touched. For those who are on, please share this. This may actually save a life. The power of screening, the power of lifestyle, the power of choosing a correct provider, the power of faith. And so I want to encourage you to share this, like Slave Food, here on Instagram, on Facebook, on all the areas. I want to thank you to the nonprofit that sponsors us inside of Healthy Heart Nation. And lastly, I want to thank our guests once again, to Donna Green-Goodman and Dr. Henderson. It's been such a pleasure. Appreciate you all so much. Until next time, Slave Food family, we'll see you back here November 12th for Diabetes Month, Awareness Month, which impacts everything as well. And so looking forward to seeing you and connecting soon. Stay tuned, share, and like.